Basic steps of performing CPR, Cardiopulmonary Resuscitation. 1. Check the scene. Ensure the area is safe for both you and the victim. Look for any potential hazards before approaching the person. 2. Check for responsiveness. Gently tap the victim and shout loudly, "Are you okay?" If they don't respond and are not breathing normally, proceed with CPR. 3. Call for help. If you're alone, call your local emergency number, 911 or appropriate local number, or ask someone nearby to call. 4. If an automated external defibrillator, AED, is available, ask someone to bring it to the scene. 5. Open the airway. Gently tilt the victim's head backward and lift the chin up to open their airway. This helps ensure proper airflow. Five. Check for breathing. Look for breathing for about 5 to 10 seconds. If the person is not breathing or is only gasping, start CPR. CAB compressions, airway breathing. Six. Begin chest compressions. Place the heel of one hand on the center of the victim's chest, between the nipples, and place the other hand on top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. Use your upper body weight to compress the chest at least 2 inches, 5 centimeters, deep. Seven. Perform chest compressions at a rate of 100 to 120 compressions per minute. At the beat of the Bee Gees song Staying Alive. 8. Rescue breaths. After 30 compressions, give 2 rescue breaths. 5 sets of 30 compressions and 2 breaths equal 2 minutes. This is where you assess the victim for signs of life and decide whether it is time for you to rest. Pinch the victim's nose shut, cover their mouth with yours, and give a breath that makes the chest rise visibly. Each breath should last about 1 second. Continue compressions and breaths. Repeat cycles of 30 compressions followed by 2 rescue breaths. Maintain a consistent rhythm and depth for compressions. 9. Use an AED, if available. If an AED arrives, follow the prompts provided by the device. Place the pads on the victim's chest as instructed and follow the voice prompts for defibrillation. 10. Continue CPR or stop as necessary. Continue performing CPR until the person shows signs of life. qualified medical personnel take over, an AED is ready to use, or you are too exhausted to continue. 11. If the person starts breathing or regains consciousness, place them in a recovery position and monitor their breathing. Please like, subscribe, and hit the notification bell to be the first to be notified of future videos like this one. Here are additional training aids to help you remember important factor in performing CPR.